Dr. Kotaro Oki conducted studies on porcine eyes, comparing the capsule safety performance of the MST Dewey Radius straight 30-degree phaco tips versus straight 30-degree phaco tips with traditional non-radiused edges. This presentation summarizes the findings of his studies. The purpose of Dr. Oki's study was to determine if the MST Dewey Radius Phaco tips might provide a significant reduction of the risk of capsule rupture during cataract surgery compared to tips with sharp edges. For background, Dr. Oki provided this comparison of human and porcine capsules. The anterior of porcine capsules is on average 2.4 times thicker than that of human capsules. The posteriors of porcine capsules are on average slightly thinner than human capsules. So, in general, Dr. Oki concluded that the porcine capsule is similar enough to the human capsule to provide valid data for the purpose of his study, though possibly the posterior porcine capsule is more susceptible to damage, and the anterior less susceptible than the human capsule. This is a microscopic image of the tip of the 30-degree straight MST Dewey Radius Phaco tip. Notice the smoothly radiused edges of the MST Dewey tip compared to the sharp edges of the traditional phaco tip. Dr. Oki wanted to test if the radiused edge might reduce the risk of capsule rupture from contact with the tip during surgery. Dr. Oki's first test was to occlude each of the phaco tips by contacting the posterior capsule surface of a porcine eye. He used a Bausch & Lomb Stellaris phaco machine with a vacuum setting of 250 millimeters of mercury. First, he conducted 10 tests each with a 0.9 mm straight 30-degree Dewey tip and a 0.9 mm straight 30-degree traditional tip. Then he conducted 5 tests each with a 0.7 mm straight 30-degree Dewey tip and a 0.7 mm traditional straight 30-degree tip. If the posterior capsule was breached, he recorded the percentage of total phaco power at which the rupture occurred. This video shows a posterior capsule occlusion test with a traditional sharp tip. Dr. Oki increases phaco power in increments until a posterior capsule breach occurs. In this case, the breach occurred at 10% phaco power at a vacuum level of 250 millimeters of mercury. This video shows a posterior capsule occlusion test with an MST Dewey Radius tip. Dr. Oki increases phaco power in increments. Phaco power was increased up to approximately 75% without a posterior capsule breach. These are the results for the posterior capsule occlusion test for the 0.9 mm tips. Note that all 10 trials of the traditional sharp tip resulted in a posterior capsule breach. 5 of the breaches occurred at approximately 10% phaco power. The other 5 occurred at approximately 16% phaco power. Despite phaco power of over 50%, none of the Dewey Radius tests resulted in a capsule breach. These are the results for the posterior capsule occlusion test for the 0.7 mm tips. Note that all 5 trials of the traditional sharp tip resulted in a posterior capsule breach. 2 of the breaches occurred at approximately 10% phaco power. The other 3 occurred at approximately 16% phaco power. Despite phaco power of 75%, none of the Dewey Radius tests resulted in a capsule breach. In these posterior capsule occlusion tests, both the 0.9 and 0.7 mm Dewey Radius tips demonstrated a greatly reduced risk of posterior capsule breach. This helps build confidence that the MST Dewey Radius tip provides increased posterior capsule safety in case of accidental contact with the posterior capsule during a cataract procedure. Dr. Oki's second set of experiments involved comparing what happens when the anterior capsule is contacted with a traditional sharp phaco tip and with the MST Dewey Radius tip. This test was conducted using 0.9 mm 30-degree phaco tips using Ozzel Torsional Phaco on an Alcon Centurion system. The anterior capsule tests were conducted on 6 porcine eyes for each tip. Torsional phaco power was first set to 70%, and if the capsule remained undamaged, increased to 100%. Results for the sharp tip were instant capsule rupture in all 6 eyes. However, with the Dewey Radius tip, there was no capsule rupture at either of the power settings. This suggests that the Dewey tip provides an increased level of safety in case of inadvertent contact with the anterior capsule. This video shows a typical phaco procedure using the 0.7 mm Dewey Radius Tip. Note that in addition to the increased capsule safety, the tip provides excellent followability and lens removal efficiency. As part of his investigations, Dr. Oki determined the effective phaco time for the Dewey Radius Tip versus the standard tip for a range of cataract grades. As a reminder, effective phaco time, or EPT, equals total phaco time multiplied by the average phaco power. This estimates the amount of phaco time that would have been used at 100% phaco power. Reducing EPT is desirable in terms of minimizing endothelial cell loss during cataract surgery. This chart summarized EPT results for Grade 1 through Grade 3 cataracts on a Bausch & Lomb Stellaris machine. As one would expect, harder lenses require more phaco time. The data suggests that EPT performance for the Dewey Radius Tip is similar to that of the standard tip. This chart summarized EPT results for Grade 3 and Grade 4 cataracts on an AMO White Star Signature machine. Again, the data suggests that phaco energy used is similar for the Dewey Radius Tip and the standard tip. Based on his testing and experience, Dr. Oki has concluded that the MST Dewey Radius Tip offers increased capsule safety versus standard sharp tips without compromising performance. He strongly recommends the Dewey Radius Tip.